Hello, my name is Kegan Schmicker. I'm the Executive Director for the Tipton County Chamber of Commerce. And today I'm joined by Evan from IU Health Plans. And today we're going to do the state of healthcare, both I think from a macro level and in a micro level into Tipton County. First, I do want to thank our sponsors. The presenting sponsor for this entire State of the Community series is IU Health Plans. And today's event is specifically sponsored by Hewlin Family Dentistry. So a big thank you to them for making this even possible. And this is really our first digital opportunity to provide this content to our membership. So we're excited about that opportunity. I'm excited that you're joining us here today to talk about healthcare in Indiana and Tipton County. So with that, I really wanted to start with an explanation, why IU Health Plans in the Chamber of Commerce. And so when I joined the Chamber of Commerce in September 2020, one of the first initiatives that I explored was a conversation with IU Health is where it started. And I was exploring the idea of how do we as a Chamber of Commerce help facilitate this conversation of healthcare for our membership, because as a community with 84% of our businesses employing 9 employees or fewer, we know that healthcare insurance is an incredible challenge for businesses. So we began as the Chamber of Commerce exploring through our connections with IU Health, and was fortunate enough to get connected with you at IU Health Plans. We really started to create that relationship. So maybe our friendship's a little old now, but I've enjoyed every minute of it. And through that partnership with you, we were able to create the IU Health Chamber Plan, which we'll touch on later in the conversation. But from your perspective, IU Health Plans, why was it valuable to you to partner with us at Tipton County Chamber of Commerce and other chambers now to create this solution?
Yeah. So to give a little bit of a backstory to and why I do what I do. So my parents growing up owned a very small business. They had anywhere from 8 to 12 employees at any given time. And you see all the struggles that they go through on a day-to-day basis. And healthcare really shouldn't be something, aside from your annual renewal and making sure that you have what you need for your employees, really shouldn't be a focus for you on a day-to-day basis. So creating a solution that has a really good member experience, creating a solution that has high quality care, and finding out ways to drive down the overall cost of healthcare or to create something different in the market. Right. And so that's kind of my background and why I do what I do on a day-to-day basis. But also, when you start to look at industry trends are spiraling out of control. I've got some data here that I'll read off to you guys. Premiums for employers and employees increased by 27% from 2010 to 2015. On top of that, while your premiums continue to go up, and we've seen that a similar spike over the course of the last 5 years as well, or from 2016 through 2020. Single deductibles, family deductibles are going up at a rapid rate also. So you're getting less for paying for more, meanwhile standard inflation is occurring. Right. So it's just not reasonable to have this type of healthcare, with the exploding costs. It's not fair to all of the communities that healthcare services provide. So on top of that, we've started to see a lot of trends related to mental health and substance abuse. We've seen people delaying preventive care as a result of, calling in and maybe not being able to get into their provider right away because of all the COVID-related things that have been going on over the course of the last couple of years. And we've also seen a significant decrease in exercise and nutrition in general. Sure. So these are all stats or studies that are done either by Kaiser Family Foundation or PricewaterhouseCoopers, and we need to make sure that what we're doing and partnering with people like you, Kegan, and your chamber are making sure that people get access to the right care at the right time and focus more on prevention. And we felt like partnering with chambers was the best way to start getting the word out there. And Tipton is one of the first chambers that we're partnering and piloting some things with an extreme focus on prevention. Yeah.
So as you just mentioned, we were one of the first to create this relationship, which is exciting for us because we're able to pioneer something in the state of Indiana with a incredibly reputable organizations such as yours, but then also going back to the needs of our community members. So if 84% of the businesses employ really less than 10 employees, it's the acknowledgement of those are the businesses who are struggling to attract and retain talent. And one of the big reasons that you would speculate is based on benefits. It's the amenities and benefits you can offer your employees. And if health care or health insurance for an employee is an expectation when you come in the door, and then to learn throughout the interviewing process that we actually can't afford to offer you health insurance, immediately you're already on the back burner for a candidate who's potentially interviewing at other places. So that was exciting for us to be a pioneer there. But then as we sort of take a step back now and talk about the health care industry in general, can you provide us with some updates? What's been happening? Of course, we know the pandemic. There's no question about that and the effects it's had on healthcare, but then also just the other effects that are happening to the healthcare industry and that you guys have recognized and are hoping to address in some fashion.
Yeah, so we have a number of things. Again, back to the last comment about mental health, substance abuse, people not getting the right care at the right time. We've done a number of things here to help focus on that and to focus on overall cost. I mean, the biggest issue that you hear about on a day-to-day basis, and there are studies in the news constantly, are about how Indiana costs are really high, or those type of things. And so what we're doing at IU Health Plans, and at IU Health Plans, we're directly integrated and connected with the IU Health system. And so that provides a lot of value to us that we can then pass on to employers in the community, and then therefore the employees that work there. But some of the things that we're doing are we've created some new pricing methodologies with our providers to help reduce the overall cost of healthcare. So first and foremost, that's the biggest piece. Right now, for our 2022 plans, we're on average 17% below what Anthem or any other carrier is in the marketplace with our new products in our core areas. So just right out the gate, 17% differential, and that's the type of thing that we want to pass on to Tipton County. That's what we want to put out in the community, and we want to show our commitment to keeping that cost of care down just purely based off of that. We've also started to integrate some other services into our plans like EAP. So we want to make sure that if people are going through any challenges, either family related, work related, whatever they are, that they're able to get access to services to address those needs immediately. For larger groups, we've started to embed wellness into our plans also. And so that's been really positive, and we've seen a huge uptick. But we're also focusing on reducing copays for specific types of services like mental health and substance abuse, because we don't want that to be a barrier to care. People need to make sure that they get it when they need it. And then, as we've kind of talked about, and what we'll go hit on here in a little bit, we've started adding some chamber value adds as well, because we want to make sure that people in your community feel like they're getting the most out of their plan, and they're partnering with you to create those relationships as well.
Yeah. So we talk about mental health throughout this and the opportunities that exist with the chamber plan, but also just in the IU Health Systems network. How big of a focus has that been for you guys as an organization, and how it's influenced some of the programs or activities that you're distributing or unveiling?
Yeah, so by implementing our new network, and we went live with this in January 21, and we've received a tremendous amount of network or positive feedback on the network. The network really allows us to provide an integrated care experience, and allows us to help navigate that person's experience from the time that they go in for their initial PCP visit to go into the hospital if they needed to have any surgeries or any specialist visits. It really helps us navigate that care experience, and hopefully we'll be able to significantly reduce the waste that goes on in healthcare, because a lot of times, honestly, people will self-diagnose and they will go and they'll try to go straight to a specialist, and it may not have been necessary if somebody was there to help them navigate that experience. So the intent is to make sure that with the network that there's a reduced cost and you're incentivized to go get your care because it's not a barrier anymore, but also to make sure that there's that integration throughout so that you're getting the right care when you need it.
So one of the questions that I have, just as maybe a consumer, the healthcare system, is a question that there's an increase of the adoption of virtual visits for doctors. I don't know if that's a question that you even know, but do you know if this is going to be a technology that's here to stay, and that it's really going to be the first opportunity? Because I could see that being to lessen the barrier to entry. If someone is afraid or hesitant to go see a doctor, this might be an easy opportunity to at least get their foot in the door to provide them with some comfort that we are, in fact, health professionals here to help you. Do you know if that technology is, IU Health is going to remain committed to that and continue to accept virtual doctor visits?
Yeah, I think virtual visits are going to be a huge part of how healthcare is administered moving forward. And I'll give you an example. Share my own personal experience in a virtual visit. But so a couple of years ago, I was having a little bit of some chest pains and some other things going on, and I actually they were able to diagnose me with an infection on my lung through a virtual visit.
Through a virtual visit?
Through a virtual visit. So within that same day, I was able to pick up a prescription, and within a matter of 2 to 3 days, I was better. So
Wow.
it's just amazing the number of things that you can do virtually, and I really think that virtual visits are here to stay, and I honestly believe that there may be opportunities in the marketplace where virtual visits become like a 24/7 type of access to care, because a lot of times, especially when you have a newborn or somebody that can't tell you how they're feeling at that time, you need help triaging that care, and so that can be your initial access point after hours to make sure that you know, should I go to urgent care, should I go to the emergency room, or what access point I should have.
Yeah, so as a father of a 26-month-old, I could, as you sort of say there, that when they're not able to communicate what's wrong or what hurts, it's good to have somebody, and we've had the virtual visit where they're providing us questions that, yeah, she does have that symptom, or yeah, she has behaved that way, and it really helps because as a new parent, you're like, I have no idea, right? How to triage this. So those virtual visits have been, even for our own family, very valuable. So it's good to hear that IU Health is going to stay committed to that, and it's incredible to hear your story even about a lung infection through a virtual visit, because we would just assume that the common cold or a sinus infection, but to hear that there's even more complex diagnoses that can happen virtually is incredible. So taking a step back, and we talked about the healthcare industry in general, but let's talk more about the chamber plan. What are some of the value opportunities as we started to unroll this? Really, I think it was about mid-year last year. We've started conversations and connecting people with you guys, and we've actually, in 2022, have had an increased number of our chamber members reaching out, asking questions. So just focus a little bit on what that chamber plan includes, some of the values there, and how we're you and I partnering in our organizations to help solve the challenges.
Yeah, so as I mentioned, the biggest value is price, and you're going to get the price savings with us in our core markets regardless of whether or not you participate in the chamber. But what Kegan and I have focused on is really trying to figure out what things are going to be valuable that we can integrate into the solution, that focus on getting the right care at the right time, providing access points, and really giving resources to people that they may not have normally had. And so an example of the value-added services would be a diabetes education and management program where you can get access, and we'll have all of it figured out behind the scenes, right? When you're enrolled with us and you're enrolled with the Tipton County Chamber. But we'll have it all figured out behind the scenes that we'll be able to identify people that need help managing or may need help or may want help managing their diabetes in general. And so we're adding a diabetes management and prevention program that will actually provide free resources as well, like your diabetes test strips and those kind of things that you're used to paying for. And really the intent is to make sure that we're focusing on prevention with that. We have a full team. It's called our Healthy Results program, but it's really our wellness program that we utilize across our entire employee population. If you don't know, IU Health has, I think, around 35,000 employees, and we have a significant amount of our population that's enrolled in our own Healthy Results program. So those same coaches that are doing the work for our own IU Health team are going to be available for those people that want to do some opt-in health coaching to help get through and navigate their own experiences. Also with that, there's a wellness portal that they would get access to, so they can go in and see exercise videos and what should I do to help improve this and that kind of stuff. So those are some of the high level things that we're doing to integrate in. But on top of that, I had mentioned EAP earlier. We'll give free EAP services for all employers.
What is EAP?
Sorry, Employee Assistance Program. So it will help focus on any families that are struggling, that need some counseling. If you're struggling with work, just somebody to talk to get through that. And that's typically an added expense for an employer to purchase that if they want to do that. So we just integrate that into our offering.
So you talked about these other opportunities, the wellness coaching, the EAP access, the counseling for diabetes. So you're telling us that through this chamber plan, you actually get those opportunities, those availability for free. There's no upcharge beyond the plan to gain access to that.
That's correct. Once you elect into one of our plans, you would get access to all of those things, plus a couple of other things as well. Like I said, we're focusing on mental health and substance abuse. We have a company that we're partnered with called My Strength that specifically focuses on that, and you'll get access to that. Get access to Clicatine, which is a tobacco cessation program. And then we're also trying to figure out ways to get creative too, like with flu shots, right? We want to make sure that people have access to free flu shots in the community. And so one of the things that Kegan and I have talked about is we can literally just bring a team here that can do flu shots for everybody that's enrolled within one of our plans and enrolled with the Tipton County Chamber to come and get those free for them and their families. And so that's another thing that we want to do, and we want to try to get creative. We want to focus on prevention. We want to focus on value-added services and focus on community in general.
Yeah, so you keep talking about prevention, and really through our conversations early on, that was one of the key points that attracted me to IU Health Plans is because of the attention on prevention. What's the easiest way to reduce healthcare costs is through prevention, not even needing to go into the health system to begin with. So as you keep mentioning that you and I continue to have conversations, and how do we make this the most valuable healthcare plan possible, and we keep adding some preventative health measures, and so I think that's valuable to us as a community and our business leaders, but also the state of Indiana. Indiana is not exactly a healthy state in general.
No.
So the more I think that we can help promote and educate on the prevention side of things and living a healthier lifestyle, I think that'll be valuable and important too moving forward.
Yeah, absolutely. And I actually made a decision yesterday. So one of my roles is to work with our product team leader and figure out what we want to implement in future years. So we actually just made the decision yesterday to move forward with a preventive prescription. We're calling it a rider, but it's added or enhanced prescription services at no cost to members. So we have historically followed just traditional guidelines for what prescriptions are required to be covered as part of a benefit, but we're seeing the value, and part of the value is just the member experience, right? Sure. We had one group that came live with us, I think it was July of this past year, and when they came live, they had several members that were paying several $100s for a prescription before, and now they are getting those free of charge to them. So it's just a significant shift. So what we're doing is we're really focusing on adding in a number of other prescriptions that are considered, expanded preventive in that regard. And so that's not anything specific to the chamber per se, but that's just our commitment to the community for any of our groups that are coming on board with us in our core communities.
Right. Yeah. So as we look at how does an individual, if they're a chamber member in Tipton County, what does their onboarding process look like to get, let's just start with a quote. How do they get a quote from IU Health Plans regarding the chamber plan that we're talking about?
Yep. So to get a live quote with us, you actually need to be partnered with a broker or consultant to get that, and that broker or consultant will help you navigate through that entire experience and really hold your hand through that. We actually just launched an online portal, though. Very seamless experience. Had somebody externally test it out earlier this week, where you can go and you just have to enter a few key pieces of information regarding your employer, specifically where you're located at, because that makes a difference. And then enter in the dates of birth for your employees, and you can get an illustrative quote. So, and that will be emailed to you directly. And so that is kind of your initial way, if you don't have a consultant or a broker, to kind of see the value add related to the price. And then there's also going to be some marketing material posted out there as well to learn more about our plans. But you can do that from an employer perspective. If you're already partnered with a broker, you can get a live quote, because the quote through the portal for employers is just illustrative purposes, just to show that value.
Yeah, so really the conversation starter for an employer, and as you said, that portal is getting unrolled or rolled out to the Chamber of Commerce is going to build a page on our website to help inform individuals about this chamber plan and then gain access to that portal so they can at least get the illustrative quote to help inform a conversation, that it's not this ambiguous or assumed value or cost, that they can help start that conversation, get connected with your team. And so it was exciting to hear you talk about that, because it really helps us as a chamber communicate. How do you get enrolled? How do you start the conversation with IU Health Plans and gain some appreciation for what it is, the savings that are associated, as you mentioned, 70% savings compared to other competitors in the market. So that's valuable too. Yep. So we're excited about that portal and gaining people some access to your guys' team.
Yep. And just to kind of add on to that, we are 17% better than the rest of the market, and on average. You will see, it's possible your plan based off of your demographics, you could be 14%, you could be 25%. It could vary a little bit, but on average, what we're seeing across all of the rating models for all of the plans is about a 17% average.
Yeah, and I think with the chamber plan, one of the key leverage points is the IU Health system. So that was one of the things too that was attractive to for us, the Chamber of Commerce, was because we had an IU Health system in our community. But the plan doesn't need to use exclusively the IU Health plans, does it?
So it primarily uses IU Health for that integration purpose and to help that member to navigate that member experience. Up in this area, though, I think AHN, American Health Network, is pretty prevalent. So we've supplemented our IU Health Select network with AHN. To help build that out a little bit more and make sure that people can get the access to care that they need. But it is primarily focused on IU Health.
Right. Yeah, that's fantastic. Anything else that regarding the chamber plan that is a value add that you'd like to take a moment to educate the community on?
Nothing really specifically, but our team is happy to help. One of our sales team members is actually from Tipton, so Ethan Harper has been a very valuable team member for us. And whether or not you go through the illustrative quote and you want to learn more, Ethan will be a tremendous resource to you. Or if you go through and already have a broker or consultant that you're partnered with, Ethan will help hold everybody's hand throughout that entire process. So the idea is to make it as seamless as possible, to focus on prevention and to make sure that we're working with you and your chamber and your community to make sure that we're continuing to expand upon value add. So, out in the community, if you guys have ideas, don't hesitate to go to Kegan with those about could we do something like this, because he now has a resource that, can partner with IU Health or partner with the health plans or wellness resources, and we want to focus on prevention in the community.
Yeah, so I think just to wrap up, again, if the chamber members, community members do have further questions regarding the IU Health Chamber Plan, don't hesitate to reach out to me. As we mentioned, we're going to be building a page specific to this plan on our website, but of course all that's presently in development. So that'll be out soon. But until then, if you do have questions regarding the plan, if you have ideas, maybe specific health challenges that you're experiencing or health ideas, prevention ideas that you think we could integrate to serve a broader audience, don't hesitate to reach out to me at the Chamber of Commerce, and we can help facilitate that conversation until then. But for now, Evan, I appreciate you joining me today. The information you share and continue to share with me it is fantastic, and I think it's a real value add to our business community, and I'm excited to see more and more businesses locally at least taking that next step to gain some information to see how they can compete for talent, because talent attraction and retention is an incredible challenge being experienced across the nation, not just in Tipton County. So I hope that this helps solve some of those pain points for our members. But again, thank you for joining me today. And my name again is Kegan Schmicker with the Tipton County Chamber of Commerce, and we thank you for joining us.